this now, COVID-19 infections are on the rise in the country. 2,465 new infections have been recorded in the last 24 hours. 114 more people have also sadly died. Gauteng, with almost 2,000 new cases, has almost 80% of new infections in the country. So for more on this, we're now joined by medical researcher and chairperson of the Health Products Regulatory Authority, Professor Helen Rees. Thank you for your time and good morning to you. This is absolutely concerning. When we look at those numbers from where we were yesterday to the previous day, we're seeing a rapid increase, particularly zoning in on Gauteng. We're sitting at over 1,000 cases. What would we attribute these numbers to, Prof?
Well, first of all, if you remember, we've been talking about having a fourth wave for some time. So many of the experts who've been looking at this have said if we're going to get a fourth wave, it's likely to come in November, December, and it's likely to be driven by behavior. So what we're seeing with these increased numbers is that a lot of them are young people, and it seems to be associated with young people letting their guard down, getting together, being more social, the year end is coming, and so on. So on the one hand, that is one of the drivers that we were almost expecting. On the other hand, we do have now a new variant that's been observed with which we haven't seen before. And we do know that some of the changes we're seeing in this new variant are the sort of changes that increase transmissibility, make the virus more infectious. So it could be a combination of both those things.
Yeah, medical experts or even health experts saying that there's a lot to learn from this variant. Did it come as a surprise?
Well, I think the variants always come as a surprise because we can never predict what they're going to look like and how they're going to behave. But on the other hand, I think everyone in South Africa and the world now knows that this virus does change. So we have been expecting that we would get new variants, and that's why we're looking for them all the time. But the worry about this variant is that it's got a lot more mutations than we'd previously seen, and that's been a surprise. We recognize some of the changes, some of those mutations, and we know that those are associated with increased transmissibility and possibly reducing the viruses, the impact of vaccines on viruses. So we know that. But a lot of the other changes that we're seeing, we don't know what they mean. So we are trying to understand what the impact of these mutations will be on the way that the virus behaves.
All right, so what we're trying to figure that out, Prof, what's then the best form of protection and intervention now?
Well, I think while we're trying to figure it out, you're quite right. The biggest message that all of us, all the healthcare workers, all the scientists are saying to everyone is please go and get vaccinated. That is our biggest weapon at the moment, and we haven't got those numbers. That 70% that we wanted to target, we haven't got that yet. So please go and get vaccinated. But the second thing is all of those measures that people might have let their guard down a bit, the masking, the distancing, being careful not to have crowded spaces that aren't ventilated, having meetings outside, opening up windows, all of those things become incredibly important as we understand what these changes in this new variant mean.
Prof, would you be in support of a lockdown? And if so, how do you think government can consider, sort of implementing this lockdown? Because there's a lot to consider here. The liquor traders calling government to please not make any hasty decisions. The hospitality industry obviously being hard hit now. This UK red list where South Africa has been placed again in the ban list, obviously impacting them as well. But from a professional and medical perspective, what's your then advice to government when it comes to lockdown?
I think that there's two things to this. One is that the MAC is actually looking at this, the Ministerial Advisory Committee at the moment. And I think importantly, what we're looking at on the MAC is to say which of the measures we've introduced will really make a difference if this virus is more transmissible. So we're looking hard and we want to be evidence-based. So we don't want to say, do everything we did first time round just because we did it first time round. We're saying what really makes a difference. So that will be the one thing. The second thing is we're going to monitor very carefully hospital admissions, because if the hospitals get overwhelmed, then we might have to introduce measures marches to try and reduce other hospital admissions. That was things like curfews to try and stop motor vehicle accidents and violence. But we want to be very evidence-based about this, and we want to say whatever we recommend must have a so what to it. One thing we will be looking at, however, is mass gatherings. If this virus is now more transmissible, mass gatherings are one of the major things that are really going to drive the numbers up and drive them up very rapidly. And of course, it's year end. So that is a consideration in addition to everything that has to keep going, the mask wearing, the ventilation and the distancing.
All right, Prof, before I let you go then, let's talk about briefly vaccinations. What's the strategy when it comes to that? We understand vaccination, trends are currently declining in South Africa. The president had a very ideal target. It seems we're not hitting that target fast enough from, at least the president's perspective. So what's in the strategy to ensure that as many South Africans or people in South Africa are vaccinated?
Well, I think there are three things. One is that we need to make sure that the vaccination is accessible for everybody. For those of us who have cars, who might be living in cities and so on, that's one thing. But if you're in a rural area and you don't have a lot of money and transport's a consideration, we've now got to take the vaccines out to where people are. And we've got to find the marginalized groups that we're missing, people who are homeless, people who aren't coming forward because they don't have the right documentation. So that's one set of strategies. The second one is that we need to be able to address people's concerns. A lot of people aren't coming forward because they're hesitant. They're saying, we're not sure. Is it safe? What does this mean? What does that mean? We need to listen to those questions and we need to continue to answer them. And we need to reassure people. We're now rolling out 2 vaccines. They've got a very good safety profile and they're effective against severe disease and hospitalization. So we need to keep that message coming, but answer people's concerns. And the third thing, though, is all ages. Let's get those young people who are vulnerable to get a vaccination. They need to get out there and get.
Absolutely. Thank you so much, Professor Helen Rees. Due to time, we have to leave it there, but I appreciate your time. Professor Helen Rees coming there from the South African Health Products Regulatory Authority, talking all things about this new variant.